everyone. Welcome back to another episode of Behind the Counter with NJSHP, a podcast that takes you outside the classroom and into the real world of pharmacy practice.
Each episode, we sit down with practicing pharmacists from a variety of clinical specialties to give you an up close into what they do, how they got there, and what's it really like.
My name is Shiloh Dwan, and I'm a current P2 pharmacy student of MSOP, and I'm part of the PR projects committee.
My name is Sia Majumdar. I'm a current PP2 pharmacy student and also part of the public relations projects committee at Rutgers NJSHP.
So for today, we have the pleasure of speaking with Dr. Cardinale, a clinical associate professor and class of 2013 alumni here at MSOP, and a critical care pharmacist at St. Peter's University Hospital. She is also one of our faculty advisors for NJSHP. Woo.
So, Dr. Cardinale, thank you so much for being here today. I know we just gave you a rundown on your career, but would you like to introduce yourself as well?
I will, yeah, absolutely. And thank you for having me. It's an honor to be part of this. And I think you guys are doing an incredible job with this podcast. So I'm really delighted to be featured. It's such an honor. So yeah, as you mentioned, I graduated from Rutgers, the 6-year PharmD in 2013. As a P4, I had no idea what I wanted to do, right, until I had clinical rotations. And so I actually had a rotation here at St. Peter's University Hospital. That was my first clinical, cycle 5. And that's what got me interested in critical care. And so ever since, I really knew this is what I wanted to do. I did my PGY1 at Cooperman Barnabas. At the time, it was St. Barnabas Medical Center. And I did my PGY2 specializing in critical care at Yale New Haven Hospital in Connecticut. And then just as I was graduating, this job opened up, and through the connections I built through my rotations and my residencies, I was fortunate that, everything kind of fell into place, and I ended up here doing academia, something I never really expected that I would be doing. So here I am. I've been doing it for 10 years, and I love it every single day. So
Nice.
yeah.
You can give a quick explanation of what is critical care pharmacy?
I think people get scared of critical care. So I can tell you kind of what I do on a day-to-day basis. So as a critical care pharmacist, I practice at St. Peter's in New Brunswick, right? 10 minutes away in the adult ICU. So it's a mixed medical, surgical, and cardiac unit. We have about 15 beds that are active. And the types of patients we see really varies every day. But I'll see a lot of sepsis. I see a lot of respiratory failure, things like bleeding patients, hemorrhage patients, strokes, diabetes, diabetic emergencies. We have one of those today. Overdose cases. We see a lot of heart attacks. St. Peter's is a hospital that does a lot of deliveries for babies. So I do see a large proportion of pregnancy emergencies like preeclampsia, postpartum hemorrhage, I think more than my colleagues do. And as a member of the team, I work really closely with intensivists who are ICU trained attending physicians, as well as residents, nurses, respiratory, social work, dietitians, physical therapists to optimize, the care of these critically ill, complicated patients. And so these patients are a little unique because they may have multiple acute problems, and they require a lot of support. And the support we provide includes ventilators, vasopressors, analgesia, sedation, other supportive care. And so we spend our time as a team working towards making sure we're hitting our goals with our supportive care and our management of whatever the situation is or whatever the disease state is. So my role is to provide recommendations on the pharmacotherapy, balancing risk benefits, especially when it's really complicated. One decision impacts another area of this patient's care. I do other things as part of this role. I sit on multiple committees at the hospital. I update a lot of guidelines, order sets. I create policies. I collaborate with other disciplines to standardize practice. So we're pretty involved in, making sure we're doing the best practice when it comes to ICU care. I also do a lot of education. So I do multiple lectures throughout the year at the hospital for residents and doctors, nurses, pharmacists, and I'm part of the residency program here, the pharmacy residency program. So I take residents as well. So that's pretty much what I do in ICU. Okay. And that's what basically is the critical care part of my job.
Okay, that's great to hear. So, so what made you choose to pursue pharmacy, and why critical care in comparison to other specialties in pharmacy?
Sure. I originally wanted to be a dermatologist, actually, or a math teacher. But my plan was to do PharmD, then MD, which is what my dermatologist did, actually. I was like, oh, that sounds like a nice pathway to become a dermatologist, whatever. But once I started P2 year and I started working at Walgreens, I became a lot more engaged with the profession of pharmacy and seeing how much impact a pharmacist can have in their job. And then I started the clinical rotations. And I think that's when I really fell in love with clinical pharmacy. And I felt like I could see myself doing that forever. So I kind of came to realize that, maybe pursuing medicine wasn't for me. It's a lot of extra training. It's a lot of long hours, and it wasn't necessarily compatible with my personal goals. So that kind of pushed me away from that. And then I saw myself really fitting in with clinical pharmacy. And then in terms of critical care, like I said, it wasn't until my rotation here that I really experienced ICU. But I did keep an open mind throughout my training, so the rest of my rotations and my PGY1, just in case I changed my mind. And I always encourage students, you may experience something that you're like, this is what I want to do, but nothing is set in stone. So you should always keep an open mind because you never know how something might, shift your focus or your priorities.
Right.
But then after I experienced all the other rotations, I realized this was what I enjoyed the most. And I think what I love about ICU is, it's every day is different. And every day, every patient can change in an instant. Their status can change within minutes or hours, right? And that's not necessarily true in other patient populations. So I find that we're always on our toes. We monitor very closely our patients. We spend a lot of time with them, that's why they're in the ICU, so that they can be aggressively monitored. And so when I'm there, I participate in bedside emergencies like code blues, intubations, RSI, arrhythmia management. I usually help draw up medications or participate in making decisions on what should we give next whenever I'm at the bedside. So I find that to be exciting as well. I think another thing I really like is sometimes, you start a medication in the ICU, you can see the impact of that change shortly after, maybe instead of waiting for like days to weeks later. So I find that to be really interesting. It helps me tailor therapies for my patients to their response, right? So it's kind of like seeing real time how the drugs are working for your patients and then making decisions based on that. And then the last thing I want to comment on is how collaborative the ICU is. So like I mentioned earlier, I work with all different disciplines very closely, and we make decisions together. We weigh risks and benefits together to make sure patients are getting the best care. I'm lucky to work on a really collaborative team that is really, willing to listen to everybody's perspectives. So that makes it really easy for me. So those are things that I really love about ICU.
Nice. Yeah, so I actually had my rotation at St. Peter's for my IB summer IB rotation.
Yeah,
And
nice.
like and so often I heard like cold blue sometimes at the hospital. I like for me personally, I got stressed out just hearing the cold blue. I'm like, oh my goodness, what is happening? So my question for you is like, how do you kind of manage the stress or like the pressure of being a critical care pharmacist? Because like for me, I can't imagine what is like in like during those cold blue moments, like just being able to kind of keep calm and just like maintain your composure and stature during those moments. So like how do you kind of manage that?
Yeah, no, it's hard, especially if you're not used to it. So at this point, I've been to a lot of them. So, but even when I show up at a code blue, I may see something that I've never seen before. So I'm always going in prepared for the fact that like something may happen here that I've never experienced, So like just keeping yourself on your toes is really important piece of that. But also recognizing that everybody else is nervous too. It's something that I've learned is, it's nerve-wracking for everyone who's in that situation. So, and if you don't know what a code blue is, by the way, this is the sickest patient in the hospital. This patient's heart stopped, right? So we are doing everything we can, including CPR and ACLS, to bring this patient back. Like, that's crazy to think about. And many times we won't be successful, even if we do everything right, right? So I think it's coming from practice, experience, putting yourself out there, but just staying. I think what helps me is stay focused on my job. So my job there is meds. And sometimes if I go more so than the other pharmacists, I will do other things like maybe document or help make decisions on what to give next and stuff. So I'm focusing on what do I need to know and trying not to get too distracted by the noise and, everybody's high anxiousness and a lot of yelling. So we try to just like focus, who's the team leader? Who do I need to be listening to and what's going on, and just like stay in my zone and stay in my lane as well. And I think those are things that help me. I'm actually doing today training for the new pharmacists. So every year I train the new pharmacists at St. Peter's on going to code blue. So we go to a sim lab. We have a sim lab at the hospital. And the current APPY students are going to be doing CPR on the mannequin. But we do our best to prepare in a simulated environment. We're not just throwing them in there, right? Because it is stressful. But even with preparation, there's nothing like the real deal. And so you gotta get experience doing it and just put yourself out there. We offer a lot in those situations because to take the pressure off the nurse to focus, that she doesn't have to focus on the meds, he or she doesn't have to focus on the meds and can do all the other things that the nurse needs to do. That's such a big help for them, like at a minimum. So yeah, today our residents will learn how to go to codes. So next week they can go by themselves.
Mhm. Yeah.
Nice.
Oh, yeah. It sounds stressful, but like as a PP too, like I feel like my main goal of like finding a career is just something that that's like an everyday situation. So that sounds so interesting that critical care has to like you have a new situation every day and that's yeah.
Yeah.
But talking about critical care, are there any misconceptions about critical pharmacy you would like to clear up?
Well, I do think one misconception that students tend to have is it's hard. ICU is like super hard and everybody's so scared. And also that ICU preceptors are tough. At least that was a perception that I had as a student. But I like to think I'm not that tough, okay? I I try to make it digestible for the younger learners like you because it's not that it's hard, it's just a different way of thinking. It's not necessarily that it's like extra work per se, but it's just you just need to practice being able to do the critical thinking part and the clinical judgment, which you're not born with. It's something that we want to practice. Because a lot of the decisions that I make, they may not be cookie cutter decisions. The patients are very complicated. They may not look like the textbook case. There may be other complicating factors that make your decisions a little bit more challenging. Um, or maybe they just don't respond to your therapies and you have to try something different. And so being flexible with that. So I think a lot of times they don't fit the classic case and you need to make hard decisions. So that takes practice, right? It takes knowing the risks and benefits of therapies. And that's something you develop over time. So I think, don't be afraid to practice the skill on rotations because it only gets better with practice. It's not something you're born with. Nobody's expecting that. So I think that's something that I think students get, are maybe a little frightened of, but it's not scary. And I don't think all of us are scary. Maybe some of us are, but
Mm, who knows? Maybe I'll see you next year when I do my hospital
yeah,
rotation. We
there
shall
you go.
see.
How do you balance your time in being a professor and also working at the hospital in
That's a great
critical care?
question, which I didn't understand until I started doing it. So as faculty, we split our time between hospital responsibilities and like academic responsibilities. So my faculty life is didactic teaching and lectures, experiential teaching at the hospital, which we take students most of the year. I work on committees at the hospital. I do advising for students, mentoring for faculty. I work with the student org, so I'm an advisor for NJSHP, which is something I really love doing. But I also have a lot of other obligations that kind of overlap with clinical work that are part of academia, and that is service to the profession. So we're expected to do things like participate in national organizations, attend conferences, publish research, and the research that we do could be either about our teaching or about our clinical practice. So like I do research, for instance, on a whole bunch of quality type projects at the hospital, like anticoagulation, infectious disease, sedation, end of life care, are some of the things that I've done in the past. And then, but most of the projects that I do are geared towards improving the quality of care at the hospital. So how can we make ourselves do better? And I do involve often students and residents as part of my research. So this is how they get their experience with research, and then it also helps me to get things done faster. But I'd say, what's really great about academia is that it's very flexible. So I'm constantly reprioritizing all of that stuff with all my clinical work. Some days I have a heavier teaching load and I make adjustments. Some days I have a heavier clinical load and I have to make and balance things. And then it also gives me the opportunity to balance against personal things like my personal needs or my family needs as well. So because it's a little bit more flexible than, maybe a hospital-based job. So these are things that are valuable to me. And I've been, fortunate that we just kind of like reprioritize things as time goes on. Like for instance, in the springtime, I'm at the school every week, multiple days a week. So it's a lot of Rutgers focus. And then in the summertime, I'm a lot more clinical focused, and I might put a bunch of my projects into summertime so that I have time to get it done. So that's just, it's how you figure out how to balance based on what your priorities are.
Nice. Nice. Yeah, that's interesting.
Yeah.
That's a lot. I just listened to all that. I was like, that's a lot to balance.
It's a lot of
A lot
stuff,
to deal
but
with.
it's not that bad because, you're the one in charge. So I think that's
Mm,
really special about academia is that you get to kind of dictate some of that a little bit more than you might do in a different career.
mm, interesting. Yeah. So, going back to kind of your role as professor, what is your approach like philosophy for teaching your residents, teaching students about critical care pharmacy or just pharmacy overall?
Oh yeah, well, that's a great question because nobody really comes to my rotation with experience in this area. So I gauge my, involvement and the amount of autonomy that the learner can get based on comfort level and based on where they're at. So, I try to be as flexible as possible and spend the beginning of a rotation experience kind of learning, okay, where is this student or resident and where can we continue to develop them the most? So what are our opportunities for developing them? And just kind of like gauging, where they're at in their training to decide, how much independence they're going to get. But usually I'm pretty hands-on in the beginning just to make sure you're hitting the goals that I'm setting for you. And I also put limits to how much critical care I do, right? Because actually my rotation is an internal medicine rotation. So for someone who's not interested in critical care, which is 99% of the students I get, um, I'm not gonna go crazy on heavy ICU topics. I'm gonna focus a little bit more and tailor it to whatever you're planning to do with your career. But no matter what you want to do, even if you want to do fellowship or you want to do, I don't know, hospital-based or community even, there's skills that you learn in this setting that will be valuable to you regardless. So like critical thinking is an example, communicating to the other providers as an example. So like I try and focus on, and then like NAPLEX prep, we're going to cover lots of NAPLEX stuff. So I try to focus on those things to make sure I'm preparing you for whatever it is your goals are. But, it's very tailored. I think I have to take a tailored approach. Yeah. Um,
Mhm.
Nice.
Yeah, that sounds so interesting. Like, that you're teaching applies to like there's like so many careers in pharmacy. So like
yeah.
it's good that you're teaching applies for all of them and it just like broadens our path. So
Yeah.
speaking about finding a career path, do you have any advice for we have a lot of PP1s, PP2s, and also I know professional years like they're still figuring out what they want to do in their future. So do you have any advice for choosing a career path?
Um, Definitely just be open. So get yourself exposed to as much as possible. I think that's something I didn't do as much as a student that I wish I did, to be honest. But I find it to be just, you never set in stone, right? Nothing is set in stone. So I give this advice to learners all the time is, you never know where your career trajectory will take you. You're going to be working for a long time, like 38, 40 years, like, yeah, it's crazy. So, learn as much as you can about all the things you can do because there's no one path that everybody takes. And you never know. You never know where you're going to end up. So, yeah, take advantage of all the great things that Rutgers offers for that. I do think Rutgers has an advantage with that because we have access to so many different, networking opportunities and like roundtable discussions and programming from all of these great organizations that, give you the chance to kind of listen to what other people are doing and see if it's a good fit for you or not. So just put yourself out there and, get exposed to as much as you can. And the networking, we talk about that word a lot. And it was scary to me as a student. Like, I don't want to network. I don't want to talk to people. But you never know. And honestly, you never know when an interaction that you have with someone, even the most, seemingly meaningless interaction will turn into something really important, like a collaboration later, or even a job opportunity, either indirectly or directly. Like for me, I think my ability to network with the people that I had interacted with through my residency and even my rotations was the main reason I ended up at this job, right? So I think that you never know when an interaction is going to lead to something. So just always be looking for opportunities to put yourself out there.
We always hear the phrase "pharmacy is a small world." He's talked about like how once you get into the pharmacy world, you work for a long time. And like reading online and also like hearing from other pharmacists, pharmacy burnout is something that's
Oh yeah.
very common. It's something like talked about a lot too. So what's your advice to avoid kind of this burnout that we're starting to see a lot more?
Well, that's a really good question and very relevant right now. Because it's true. It's true in all fields, especially in healthcare, and pharmacy is no exception to that. And I think, you know, I think there was a period in the last few years where, we lost a lot of people that work here, at St. Peter's, for example, but I know it was, everywhere. And people just left the field, or they left critical care for sure, because it was exhausting. And I think there's a personal aspect to this, and you have to figure out for yourself what motivates you to do what you do every day. And so I think there was a period of time where like I was considering leaving for sure, especially as I had my kids and my priorities changed, because I have a 4-year-old and a 1.5-year-old, and my whole life changed. So with these kids, they're crazy. So, but what's helped me, I think, is just kind of refocusing my priorities and recognizing, finding the things that mean something to me in my work. So like the things that are most meaningful is my clinical work and my teaching. Those are the things that matter the most to me, and they give me the most fulfillment. So I've been, when I feel like I'm getting a little bit stressed out, I try to focus on those things, because those are the things that make me, that motivate me to keep going and keep doing what I'm doing. And so you have to find like what it is that drives you, I think, and just, take it easy and be kind to yourself. I think sometimes we expect a lot from ourselves. You guys do this all the time, and I'm always like, just take it easy. Be kind to yourself. Don't put too much on your plate. If it's not something that has to be done right now, then focus on other things. So I think there's a little bit of personal balance that you develop over time, and you learn like, you know what, this is not an emergency. I know what an emergency is. So I think that also helps, because you can't expect every job, and this is just me talking, but every job has pros and cons, right? So there's always going to be things that you think wish you were better about this job you're in or whatever. So I think recognizing that grass is not always greener when you go somewhere else, and just kind of identifying what are the things that I think are the most important to me, and then focusing on those things. So I don't know, that's what's kind of helped me a bit.
Nice.
Hopefully I answered your question.
Oh, for sure. You definitely answered
Yeah,
it.
yeah. Okay. So speaking about being kind to yourself, which is very important, especially during like stressful times and like with your workload and everything, what are some ways that you wind down, and like what do you do in your free time to give yourself that time?
Oh yeah, well, I mean, my kids are really the main thing, because I have, like I said, 2 boys, and my husband and my dog. We have a Pomeranian Husky, and he's really fun. So those are the things that bring me joy. So spending time with them, making sure I have enough time in the day to spend time and be there for them, I think is really, really important for me. So that's something, trying to take them to a park or go for a walk or whatever it is that we can do to wind down together, I think is, something that I try to incorporate every day.
Mhm. As a pharmacist, is there like ever a struggle kind of balancing family life and professional life? Because as pharmacists, especially like hospital pharmacists, or even like your role as a professor, there's a lot going on. And sometimes like for me personally, I'm like thinking when I get older and I have kids, it seems like it's almost like an impossible job to kind of balance that family life and that professional life. What's your advice to kind of finding
Mhm.
that balance?
Yeah, no, it is hard. I think before kids, I would take homework all the time, to be honest, and it was exhausting. So, and I think having kids has helped me to realize that like I need to block time off to myself and
Mhm.
to be with them. And so that's what I do. I block time in the evening to say like I'm not available. I mean, I might be available for an emergency call, which I do get called, not often, but a few times a week probably. But other than that, I'm not checking my email. I'm not doing any work, right? I need to be present for my family. And so that's something important to me. So I try to keep my phone away, and, my the computer's closed, like I'm not doing work at this time. And so that kind of protecting that has been important to me because it's something that's important to my well-being. So I think we have to work. We have to figure out how to do those things for ourselves.
Okay, just like a fun little question. What's your biggest pet peeve as a professor?
Um, Good question. I think something I would say to that is, when a student shows up on rotations and I'm talking about something that I know for a fact that they learned probably in multiple lectures, and they act like they've never, ever, ever heard it before. Like, I'm like, come on,
Uh-huh.
like that.
Yeah.
But I
Dang.
get it. Like, you're not going to remember everything, but like, you
Mhm.
know,
Yeah.
it
Dang.
drives me crazy.
If I was on a
Yeah.
rotation, that would definitely drive me crazy. Because my rotation,
Yeah.
my preceptor asked me stuff, I'm like, I should know this, but I don't know this.
Well, at least that is better because it's like I know I've heard it before.
I
I
guess,
just
yeah.
can't remember it. I'm like, okay.
Mhm.
I don't expect you to remember everything. I actually say like I expect you to remember 50% of what we talk about, so that's pretty good.
As a professor, what is your favorite lecture to give, or what's your favorite topic to speak on?
Oh, okay. Oh, well, I guess topic, I don't know, like sepsis maybe. I don't know. I like talking about sepsis, but I teach for lectures, sterile compounding. That's my favorite class. So it's the best class in the school. That's my
Oh.
disclaimer to you all, because I co-coordinate it with Dr. Myers, and we see you guys every single week, and we just have so much fun. It's so much fun to watch you guys grow in your confidence with needles from like day one to week 13.
Oh,
But from what I teach, I'd say my favorite lecture I teach is acid base, and it's P2 renal, but it's definitely not your favorite lecture to hear.
no. I guess that'll be me next semester, huh?
Yeah.
Oh.
I have a couple years till then. Quite scared. Yeah.
Yeah, lucky you. No, I'm
I
kidding.
Uh,
just yeah, I work at CVS, so like we just started doing immunization and oh my God, I'm like holding the needle, I'm like shaking. Yeah. Oh my
You'll get used
yeah.
to it, yeah.
Yeah. Do you have any questions for us as students?
Questions for you. I don't
Mhm.
know. What's your favorite class so far? Or
Oh,
least favorite class?
please. Hmm.
You
So
can
you
be
already got
honest with
Mm.
me.
So right now I'm PP2, so I'm just taking orgo, physics. But out of like those main courses, I have to say physics is not my favorite,
Me
which
neither,
is
yeah.
yeah. I feel like it's just harder because like obviously we're doing medicine, so I understand like orgo and its importance, but like a class like physics, micro, it's just like hard finding like motivation to like actually enjoy that class because like it's not directly applied.
Yeah.
But I like my chem classes. Like I know orgo is like a class that everyone despises and it's like watch out, but like I enjoy learning that stuff, I think, because I know it's gonna apply later on, or hopefully it does. So yeah.
Well, you never know with physics because I used some principles of physics in a lecture I gave recently, and although
Oh.
it was for
Okay.
nurses, and they were like, "Oh my God," it's like high school physics.
No. Yeah.
But yeah, I agree. I did not enjoy that class.
Yeah. For me, my favorite class as of right now is microbio, and that's because right now we're
Wow,
learning about like immunizations, vaccines, and kind of um,
cool.
diseases, stuff like that. And because it's so relevant to what's going on right now in the political world and also just like the healthcare world overall, it's kind of hearing it from a kind of more not
Mhm.
baseline, but more kind of scientific perspective is really
Yeah.
like kind of helped me. And then my least favorite class is Poem Heme or the module Poem Heme, but it's a love-hate relationship. I love the material, but I hate how fast it is. It's
Oh, the modules.
yeah,
Yeah.
the modules, yeah. It's because the material it's honestly like very interesting and also like I love hearing the professors kind of talk about what they're passionate about, but then it's just like I can't find the time to kind of actually enjoy it because I need to pay attention and study because we have exams every 2 weeks, which I
Mhm.
understand, but uh, stressful.
Yeah, no, I mean I didn't have the modules. We were just
Oh,
it was completely different, the original curriculum. So I can see it being challenging, but I think you'll get used to it. Yeah, because maybe you'll find that it's helpful for retention, which is the goal. The goal is for you to retain it a little bit better. So hopefully you get used to it. I'm sure you will.
Yeah.
Yeah.
All
All right, cool.
Well, I can't wait to take those classes in a couple of years, but
right. You
okay, so that concludes our fantastic interview with Dr. Cardinale. Thank you so much for taking your time to chat with us today. We hope you enjoyed it as much as we did.
Thank you. Thank you for the opportunity. And I just want to say, excellent job. You guys are doing a fantastic job with this podcast. I just love it. And if anybody listening, is not already involved in NJSHP, please consider getting involved. I think it's an excellent organization.
So yeah, to our listeners, we hope that you guys learned something from this podcast, especially about critical care pharmacy or just about pharmacy overall. I know I learned a lot about critical care pharmacy and also just kind of how to balance stuff because especially for us students, there's a lot going on in the world and our personal lives, but just being able to balance ourselves and also give time to ourselves, which is something that
There you
today was
go.
a good reminder that just give time to yourselves and just have fun. But
Have
yeah, so
fun. That's a great
yeah.
idea.
But yeah,
Very
for our
good. Thank you so
listeners,
much.
yep, and just for our listeners, if you have any questions, don't feel scared to reach out to us, or if you would see something on the podcast, just let us know.